Hello, hello, hello. Welcome to today's live. So, I saw this article and I wanted to touch on it because it is just near and dear to my heart. I'm not sure if you are aware, probably not, but I do have a video on my channel talking about my experience with breast implant illness. And recently, Danica Patrick, she suffered from breast implant illness and she's shared her journey and she explanted and she removed her breast implants. It's just a topic that I'm very passionate about because I don't say that I have many regrets in my life, but the one regret I do have is ever getting breast implants because it completely changed the trajectory of my health. Before breast implants, in high school, I played pretty much every single sport. I was super athletic. Um, but after having them in for so long, I just started developing all sorts of weird symptoms, joint pain, muscle aches, rashes, GI issues where I would get profound debilitating nausea. So I want to talk a little bit about her story and then share some studies that show that breast implant illness is real or adjuvant induced autoimmune disease. There's still a lot of skepticism in the medical community, but keep in mind that in the medical community, it's predominantly male and no male is going to tell me what I am and what I am not experiencing within my body, right? It's my body and I know what's going on with it. And breast implant illness is very much real. She was a former NASCAR driver and she began experiencing unusual symptoms 3 years after her procedure. And she shares that her hair seemed to get very dry and it grew more slowly and it began to fall out. In my experience, my towards the end, right before I decided to explant, the last symptoms that I got were very dry mouth and very dry eyes. She also began to experience gastrointestinal issues. I'm not sure what she was experiencing, but in my situation, I I actually lost weight because I would go through periods where I couldn't eat anything because I was so extremely nauseous and I would just everything would make me nauseous and I had like chronic diarrhea. She also experienced hormone disruption, including low sex hormones. So keep in mind, Danica Patrick is a celebrity. She has money. She has access to getting all sorts of studies that she can pay for out of pocket if her providers don't want to do it, right? Or because she's a celebrity, she has the luxury of being able to order these additional studies. Meanwhile, like everyday people like you and me, it was a battle with my primary care physician. My ANA came back positive, which is an autoimmune marker, and he was blowing me off. He didn't believe me. I didn't know at that time it was the breast implants. I just knew something was wrong, and I was actually in denial for a long time because I didn't want to remove my breast implants because I was afraid of what, like, am I going to be completely flat chested? Well, what's going to happen when I get those removed? But it wasn't till my friend, we were friends, he's my husband now. My friend at the time was like, "Hey, do you think it could be your breast implants?" I was like, "There's no way it's my breast implants. Like, I don't know what's going on, but I'm just sick." And he was actually the one that planted that seed into me. And then when I started looking into other women that had these issues, I'm like, this sounds just like me. And it was at that point in time, I didn't care. Once I realized it was my implants that were making me that sick, I didn't care if how I looked afterwards. Like, I was just like, get this out of me. So a year later, after this, she had one of her implants had become hard. And in the picture that I used for the thumbnail, I did see that one of her implants had actually become encapsulated, which is when like the breast hardens and it's contracted. So, an MRI revealed she thought that perhaps it had ruptured, and MRI revealed that this wasn't the case. When the other breast implant became hard as well, she started to think that her breast implants may be playing a role in her symptoms. The reason why the body forms this capsule around the breast implant is because it recognizes that it is a foreign substance and it's trying to protect your body from it. Now, I will preface this by saying, will every woman that gets breast implants develop some kind of autoimmune condition? No, absolutely not, right? But if you haven't had breast implants, you haven't had that operation, you're rolling the dice with your health because it could go either way. You could be completely fine or you could be like me. And I have spent thousands of dollars on my health because of this. Um, Thousands. Explant surgery was not cheap. I almost died from it, but that's another story for another time. Um, So she says she watched over 100 videos on YouTube and social media by women with similar symptoms. Hearing their stories made her believe that she too was suffering from breast implant illness. That's kind of like what I experienced too. I was in denial, and then when that, I was like, you know what, maybe this could be it. So she had her implants removed in April. She felt some relief within hours of the surgery. 6 months later, that she's still on the mend. Her stomach problems and hormone levels improved, and she said that she looks more like herself. And I do know she explanted a while back, but I wanted to cover this. So the FDA in the past has said that breast implants are completely safe and that there's no issue. But as many as 3 million women are estimated to have breast implants worldwide, and there has been a recent resurgence in concerns around the safety of silicone and silicone coated saline breast implants. And I did have silicone implants, and there's nothing that's impermeable. Like, I know for sure this leaked. And breast implant illness describes a variety of symptoms reported by women with breast implants, including fatigue, memory or concentration problems, joint and muscle pain, had that, hair loss, had that, weight changes, had that, anxiety, depression, rash, had that, headache and inflammation, had that. These symptoms have been reported by women with all types of breast implants, regardless of filling, shape, or surface characteristics, and onset occurs anywhere from immediately after implantation to years later. And for me, again, I had these implants in for so long that it finally caught up with my body. I think my body in my 20s was like fine and was just doing its best to heal with it. And I say fine, but I had just started developing in my 20s like severe cystic acne. And I think that this was a result of all that. Like, it was my hormone levels were being misaligned. So now I wanted to share some actual evidence. A lot of I will get, and it's usually males that'll be like, oh, that's just because you're getting older. Like, that's why you were experiencing those symptoms. Like, I'm not 30 right now, but when I was going through these things, like, no, sir, 30 does not mean you're suddenly like magically like 65. Like, my body felt like a 65-year-old woman's. I think that no matter how much evidence I share, there will always be people that will not believe, but I don't care, right? If it stops one person from getting breast implants, then my job is done. So let me have to pull this up. This is actually from the International Journal of Epidemiology. So this is actual doctors writing this, right? I'm not quoting Sally Mae Sue that talked to me and her neighbor's friend. This is actual studies because I like to back things up with evidence. Silicone breast implants and the risk of autoimmune rheumatic disorders, a real world analysis. So this is pretty dry stuff, so I don't want to bore you with it. But silicone breast implants are make you more likely to have Sjogren's, which is what I got diagnosed with several years after I explanted. Which, that's another story. I thought I had this all along, and physicians kept turning me away and basically not making me feel heard. They're more likely to have systemic sclerosis and sarcoidosis. So let me see. I highlighted a few things. Patients with silicone breast implants were more likely to be diagnosed with the following autoimmune rheumatic disorders than the matched silicone breast implant free group. They're more likely to have hypothyroidism, psoriasis, hyperthyroidism, rheumatoid arthritis, fibromyalgia, chronic fatigue syndrome, Sjogren's syndrome, sarcoidosis, and being diagnosed with at least one autoimmune rheumatic disorder. So again, look at this massive analysis that they did, right? Lots of statistical analysis, and they are finding that silicone breast implants are associated with having an autoimmune condition. One of the main supporting factors of the causal relationship between SBIs, silicone breast implants, and consequential risk of developing autoimmune rheumatic disorders is the high percentage of symptom improvement in women with silicone breast implants related disease after explantation. I did experience some improvement after. So before, when I had my breast implant in, like, literally, like, my wrist, like, I couldn't, like, everything hurt in my body. Like, I can't explain to you the amount of pain I was in, right? It improved somewhat, but not completely. And then it says that that revealed that 63% of silicone breast implant recipients who developed a subsequent autoimmune response experienced significant relief of systemic symptoms. So people that did develop an autoimmune condition, they felt improvement in, for example, arthralgia, which is like joint pain, myalgia, muscle pain, fatigue, neurological symptoms during an observation period of 14 months following explantation. It is probable that the removal of the nociceptive signal triggered by the adjuvant qualities of the silicone breast implant prompts a regression of the immune reaction. All that's saying is that it is probable that because you remove the stimuli of what is irritating the body, that this is why there's a regression in the symptoms, because the body is no longer attacking itself. Nevertheless, and this is where like my situation comes in. Nevertheless, although the majority of symptomatic women experienced clinical improvement, this was not the case for patients who had already been diagnosed with a well-defined autoimmune rheumatic disorder following silicone breast implants. This finding implies that once silicone particles have already infiltrated distant lymph nodes, such as in the axilla, which is your armpits, or the inguinal regions, they continue to produce an inflammatory response even after explantation of the original silicone implant. So, all that goes to say is to basically say, once you light a match, you can't unlight it. It's already burned. So for example, like I said before, not everybody that gets breast implants is going to get breast implant illness. But if you have a genetic predisposition, such, for example, my father smoked for years and ended up developing rheumatoid arthritis. So there's already my genetic predisposition. As a child, I had asthma. As a child, I had allergies, right? Genetic predisposition. My immune system is already revs up too much for certain triggers. So I didn't know any better. I was not a nurse when I got my breast implants in, right? I was super young in my teen, like I had just turned, I think, 18, right? So you don't know any better. I was in New York pursuing like acting. Nothing. You trust your physicians, you trust the government, everybody. Again, you're young, you're naive, you're dumb. You trust everybody when they tell you that they're safe, right? I didn't do enough research. So my father stopped smoking. His rheumatoid arthritis will never go away. So for those that are like, well, how come some people get the implants out and then they never get better? Well, because the toxins are already in your body, right? Or for me, I already got diagnosed with Sjogren's. Like it already triggered that diagnosis. Like you can't reverse that. I know that there are things I can do, lifestyle changes that make symptoms better or worse. So for example, if I eat too much sugar or like refine refined carbs, like if I just eat like simple carbs, I notice that I have more joint pain. I notice that my eyes get drier, my mouth gets drier. I notice, so when I eat healthier, like my symptoms improve. If I exercise, my symptoms improve. So there are lifestyle changes, but the damage is already done. Like this is what I have to live with for the rest of my life. And then the last one I will share is from the European Journal of Rheumatology. Again, I'm showing you evidence-based research. Of course, it doesn't matter how much evidence I show some people, like, and it's crazy. Like, if you don't believe me, that's fine, but you don't have to be a troll about it. It's crazy how much hate I will get when I talk about this. Usually, again, for males, I guess certain males still want their women to get breast implants. I don't know, but women, I'm telling you, don't do it. Like, it's not worth it. The reason why I showed you the other study is because it was more than one person, but this was Sjogren's syndrome after silicone breast implantation. Now, this is just one person, so studies are more accurate when you have multiple people, but this was a case of a 34-year-old female patient. She was admitted to the hospital for a 2-year history of dry mouth, dry eyes, and cyanosis of the fingers. Cyanosis of the fingers is like this bluing of the fingers because there's no circulation. The cyanosis manifested more distally on her fingers when exposed to cold weather. She probably had Raynaud's phenomenon, Raynaud. You can read that about on your own. She had undergone silicone breast implantation 5 years ago, and her symptoms began after the surgery. There was no history of illness or drug use prior to all this. Like, I'm the health, like I don't drink, I'm a vegan. Like, it doesn't get much more healthy. I exercise. Like, if it happened to me, it can happen to anybody. The only thing is, again, I had a genetic predisposition. The patient was negative for HIV, hepatitis. She was positive for the ANA, which is that anti-nuclear antibody that also was positive in my labs, and the anti-SSA, which is the Sjogren's markers. They were positive. She was negative for all for all other serologic markers. She was negative for rheumatoid factor. Dry eye was diagnosed with the Schirmer test. And once again, if you are a physician watching this, instead of trolling me and saying like, well, just to be fair, because again, I have so many physicians that troll me and get mad at me, but instead of watching this from a defensive standpoint, why don't you learn from it and say, you know what, if I ever have a case of a young female comes in complaining of all sorts of things, let me consider that maybe it's something else. Let me consider, is it Sjogren's? Do they have breast implants in? Like, so I have, again, there's been some phenomenal physicians that I have encountered on a professional level in regards to like working with them. And then also like physicians that I have been their patient, but there's been some that have been terrible, and they failed to diagnose me with Sjogren's for the longest, even when my Schirmer was positive. And I specifically told that ophthalmologist, do you think I have Sjogren's? Because my mouth has been dry too. I went to an ENT, my mouth was so dry. I have pictures. I don't have like, my tongue was white. It was like sandpaper. Like I had like a round circle on my tongue from the dryness of it. And again, that's improved since Sjogren's. Like that disappeared. It felt like a cat's tongue. Like it was literally like a dry patch. I was concerned. I was like, why is my tongue like this? I went to an ENT. I was like, is this cancerous? Is this a lesion? Like, what is this? He's like, you're fine. Just use a humidifier. Like that was his, no labs, no nothing, no concern, no other questions. Have you experienced dryness anywhere else? A salivary gland biopsy specimen revealed that she had lymphoid aggregates, periductal lymphoid aggregates. So basically just talking about silicone breast implantation is associated with several illnesses, the most controversial of which are connective tissue disorders. And that is, Sjogren's is considered connective tissue. Silicone in various tissues of the bodies of women with breast implants has led to the incrimination of these implants as a causative factor of connective tissue disorders. So again, this is saying that yes, breast implants can cause connective tissue disorders. It can cause like RA, Sjogren's, scleroderma, other systemic sclerosis. Here's rheumatoid arthritis, systemic lupus, right? That was my concern when I was like going through all these symptoms. I was like, I'm like a breath's away from getting lupus. Like that's how bad I felt in my body. So, in conclusion, a causal relationship between Sjogren's syndrome and silicone breast implant illness was found in the present case. From a community health viewpoint, breast implants seem to have minimal effect on the number of women in whom connective tissue disorders develop. However, they cannot be ignored. The present case serves to remind clinicians of silicone breast implants as an important cause of Sjogren's. So, basically, what this is saying is that it's not super common, but that it happens. What I will tell you is like, maybe it's being underreported. Like maybe not enough women are coming forth. So they claim that it's not that common, but that there is an association. But I definitely think that it is much more common than we are being led to believe. So again, if you're watching this and you're considering breast implants, like there's other options. You could do like a breast lift. Let's say you've had kids and your breasts are super saggy, right? You could do a breast lift. You could do a fat graft. You could have them I don't recommend that they take any like fat from your abdomen because there's the risk of intestinal perforation with liposuction, which, by the way, again, I'll just tell you this real quick. So I went to Colombia to like one of the top surgeons in Colombia, and I specifically told him, like, I can't make this up. I specifically told him I did not want any fat taken from my abdomen. He suggested a fat graft so that after the breast explant, that I wouldn't just be like completely flat chested. I specifically told him, it's like I had a premonition, intuition, call it whatever. Don't take any fat from my stomach. Like my abdomen has always been pretty flat, right? Well, guess what? I wake up from surgery and my abdomen is all bruised, right? Well, a few days later, I started developing fever, signs of septic shock. And I told my boyfriend at the time, I was like, I think I am in shock. Like, I think I have sepsis. He was like, oh, you're so dramatic. Like, you're probably fine. Like, whatever. Right. I kept getting worse. Then I started developing like vomiting. Well, turns out he did perforate my intestine during liposuction because he was trying to take fat from my abdomen to graft it. And because I'm thin to begin with, he perforated my transverse, I believe it was my transverse colon. I can't remember, but some part of my intestine he perforated and I almost died from it. So that being said, if you there are other options for if you are like adamant, like you don't like yourself, you want to get surgery, then do like a breast lift or do a fat graft, but have them take fat from like your love handles in the back where there's no risk that they're going to accidentally like perforate in your intestine, or have them take it from your thighs. um, and at the end of the day, you could just learn to love yourself, right? If you can't learn, I'm not here to judge you. You are who you are. If you're like, no, I can't accept myself in this way, like fine, then consider those things. Like after, I didn't care if they had to cut me, slash me, whatever. I was like, get these out. Like I didn't care what I was going to look like after surgery. But the surgeon in Colombia was very concerned. He was like, why are you getting them out? They are fine, blah blah. And but anyways, if you decide that you don't like how you look and you want something, don't do the implants, surgical lift, fat graft, something. I don't know. If you're considering getting them in, please don't do it. Like learn from me. I wrecked my health. Like I live in constant pain every day of my life. Like I don't talk about it to other people other than my immediate family, but I live with chronic pain. Like something always hurts in my body. Like my mouth right now is dry. My eyes are dry right now. And I've had like tendon ligament issues. I've spent thousands of dollars because I have to repair my body because my tendons and ligaments don't heal. So I have to get like PRP injections all the time, or I've had like mesenchymal stem cell injections that help, right? They heal my injuries, but they're thousands of dollars. So I hope this was helpful. I hope that this brings awareness. Yeah, make sure that you hit the like button, make sure that you subscribe, and tune in for another video next time. Leave me a comment if you want to see another video on another topic. Thanks.